everyone. Today I will explain the pathology of the ankle injury in long jump. Ankle sprain is one of the most common injury in long jump, accounting for approximately 25% of all track and field injury. This injury is particularly prominent in long jump due to the high impact landing force and the complex biomechanics involved in the takeoff and landing phase. Okay, now let's look at the factor that can lead to ankle injury in long jump. The first one is internal factor. Internal factor include weak ankle stabilizer, previous injury history, poor proprioception, and inadequate warm-up. Second one is external factor. External factor include improper landing technique, uneven landing surface, fatigue from repetitive training, and inappropriate footwork. This factor increase ankle vulnerable during long jump. Okay, now for this slide, I will explain how does this ankle injury actually happen. During long jump, ankle injury commonly occur in two phases. The first one is during takeoff. If the foot placement on the board is off center or ankle not properly stabilized, it can cause inversion sprain. The second one is more commonly during landing. The athlete land with tremendous force, 3 to 5 times their body weight. The ankle may roll inwards upon impact, especially with unbalanced landing. This causes the ligament to stretch beyond their normal range. The mechanism typically involve a sudden inversion during where the sole of the foot turns inwards, combined with plantar flexion. Okay, next, what are the effects of this ankle injury? The main structure affected are the ATFL and CFL ligament and the tibialis anterior and gastrocnemius muscle. Gastrocnemius muscle is particularly important because it stabilizes the ankle and absorbs landing impact. Weak gastrocnemius increase the risk of re-injury. The athlete experience pain, swelling, and loss of stability. They cannot bear weight properly or perform the push-off and landing control required in long jump. Without proper rehabilitation, this can lead to chronic ankle instability.
First, the exercise for early stage is ankle alphabet. Ankle alphabet is important because after an ankle injury, the first goal is to regain movement before building strength. Gentle movement helps reduce stiffness and prevent the joint from becoming tight after rest. Slow and controlled motion keeps the ankle active without causing more pain and further damage. For sprain, such as ATFL and CFL injuries, this exercise supports proper ligaments healing by giving light movement without too much pressure. Good ankle mobility is also important for daily activity and sport, like walking, running, and changing direction. Starting with ankle alphabet, lower the risk of re-injury and prepare the ankle for harder strength and balance exercise later in rehabilitation.
Next is the intermediate stage. The exercise I can recommend is the calf raise exercise. This exercise is very common for athletes who have just recovered from an ankle injury because it can help restore strength, stability, and function without placing excessive stress on the ankle joint. Calf raises primarily strengthen the gastrocnemius and soleus muscles, improve ankle stability and injury prevention during walking or running, and stabilizing the ankle during weight-bearing activities.
Next, the other exercise for intermediate phase is single leg stance. Single leg stance exercise is used to improve balance and ankle stability after an ankle injury by helping the body relearn how to control and sense the ankle position during standing on one leg, which strengthens the stabilizing muscles, improve joint control, and reduce the risk of re-injury, while also preparing the athlete for sports movement that often requires single leg support.
Next, the exercise for advanced stage is hopping exercise. The hopping exercise is chosen because it helps develop ankle strength, power, and dynamic balance through controlled single leg jumping. It is especially important after an ankle injury as it helps restore stability and improve the ankle's ability to absorb impact and reducing the risk of re-injury. This exercise is also relevant to sports because many sports involve jumping, landing, and quick changes of directions, making hopping essential for preparing the ankle for safe and effective sport performance.
Okay, next is return to play stage. The treadmill is used to improve cardiovascular endurance and overall fitness. It also helps to test the ankle during long periods of continuing movement. This allows the athlete to check whether the ankle can handle repeat stress without causing pain or discomfort. Using the treadmill is important for injury recovery because it shows if the ankle is strong and stable enough to regular activity. It's also closely related to sport performance as it helps ensure the athlete has enough endurance to perform well and stay active for the full duration of a game or match without getting tired too quickly.
So lastly, for the conclusion, understanding the pathology of ankle injuries in long jump enables the development of targeted prevention and rehabilitation strategies. By considering both intrinsic and extrinsic risk factors, athletes can lower the chances of injury and enhance their recovery process, ensuring a safe and effective return to competition.